We will discuss today this topic: psychotherapy, theoretical and atheoretical. If we look at psychotherapy, we find many schools in psychotherapy. One way to divide all these schools is to divide them into theoretical and atheoretical. Theoretical schools are those that have a very specific understanding of pathogenesis and healing, and who proceed along those lines. Their way of understanding the pathogenesis and how to heal it is very specific based upon the theory of the school. And of course, the theory comes largely from practice. These schools have very specific paths to follow in understanding of sickness and in healing. On the other hand, atheoretical schools are the schools which are largely open, which have a very broad and open principle, and they allow the problem to unfold itself in therapy, explain itself in terms of causation also, and from there, how to heal will open itself up also in therapy. So without any theoretical preconception, they go into therapy with an open mind. There are arguments on both the sides. Those who believe in a theoretical school, they believe that if we have knowledge, why should we not use it? They also say, what is the difference between being atheoretical and being ignorant? Because de facto it comes to the same thing. Theoretically oriented school also say that what they call theory has been refined over hundreds of man hours of experience, and it would be criminal not to give benefit of such hard work to patients. And if you go atheoretical, what you are doing is just trial and error. It is just a good way of saying, I will do what I like and call it psychotherapy. This is on the theoretical side. They also have empirical validation of their theories. On the atheoretical side, they find theories of the mind too complicated, and even more complicated is to synthesize them. And that being too big an adventure, too big an ambition, atheoretical schools believe it is better to go with an open mind and allow the pathology to unfold itself, unfold its possession, and unfold thereby the way to heal it. Atheoretical schools believe that theories actually restrict you because we know only a few theories and within that few concepts very strongly. We are not strong in any school, leave apart all the schools. And therefore the application of theory, as it is called, is actually application of half knowledge or even quarter knowledge, and often more dangerous than not applying knowledge at all. For example, a person who is trained in the Freudian school may just not be able to see that the causation of a problem is Kleinian in nature. But because he is theoretical and devoted to the Freudian school, he just can't accept that it can be anything else other than the Freudian school. Whereas if he was a theoretical, he would probably be more open and receptive to the patient's voice. So we see there are on both the sides arguments and counter arguments. I personally am on the theoretical side, not to be fanatic, but to have grip on multiple schools and maintain the openness of the theoretical schools. So I am actually, if you put it that way, I am for a mix of the two, 75-25. 75% of synthesis of all the theories we know in Western psychotherapy and in the East, and add to it the openness of the theoretical school. So let us go deeper into this area. If we go finer, we can divide all schools in psychotherapy, Western psychotherapy in particular. I think I should be mentioning this more often, that when I say psychotherapy, I should prefix it and specify it as Western psychotherapy or Eastern psychotherapy, because the two are worlds by themselves and very different. So if we divide Western psychotherapy schools into three parts, those schools which are theoretical, those which are semi-theoretical, and those which are theoretical. In the theoretical part, we can put existential humanistic psychotherapy, intensive short-term dynamic psychotherapy, which started off as theoretical, but we will see how it is getting semi-theoretical now and ultimately may end up as a theoretical school. Semi-theoretical schools like Erickson schools and logotherapy, which have somewhat they are not as open and blank canvas as existential or ISTDP. ISTDP in its Puritan form as it was originally. Rather, semi-theoretical schools have some structure or some broad argument. Erickson has the program of life of his own, stages of life. And logotherapy has this focus on purpose. But apart from this basic framework, they are quite open. And the third is very theoretically driven schools like psychoanalysis or CBT. Psychoanalysis on the affective side, CBT on the cognitive side. A Freudian school in psychoanalysis is very, very specifically oriented on the Freudian theory. Same with the Kleinian school, same with the Winnicottian school. Whereas in CBT, again, we see a very focused orientation on the core theory of CBT in terms of causation and gain. So let us look at what is happening in this area. We see a movement from theoretical to theoretical, and in that course, we see a very good blend of the two developing. We see that it's not possible in the long run to be a theoretical. We saw that first with hypnotherapy, where all they said was create a state of change, the trance, and allow things to happen, and problems will explain themselves in terms of causes, and you will automatically be led to solutions. So CBT started off with as that a very austere or theoretical framework, but today we have CBT for schizophrenia, CBT for OCD, in general CBT for X, which is getting more and more theoretical. needs a correction. CBT is a theoretical school, and the idea is it is going from theoretical to more theoretical. And ISTDP is moving from, let me just, now it seems correct. So we see a movement from theoretical to theoretical and theoretical to even more theoretical. So CBT always has been a theoretical school, but now we see it getting even more theoretical, in the sense CBT for schizophrenia, CBT for OCD, CBT for X in general, and then tools for each disorder. So what was in a way a less theoretical school is becoming even more theoretical school. So theoretical to more theoretical. And we see even radical shift in ISTDP from theoretical to theoretical. How has it happened? ISTDP started off as being theoretical, and the idea was as we press for feelings, working through defenses and regulating anxiety, whatever is the cause will come up, and if there is a cause which is described in theory, it will come up by itself. But soon it was found this is an incomplete approach. You can't heal a large group of patients with this. Take 3 examples. How theory has seeped into ISTDP. How ISTDP is no longer theoretical, but has already moved to the theoretical. I would not say fully, but let me say semi-theoretical. And very soon it might get theoretical. The first to come into ISTDP was Freud, when it was clear to anybody trained in psychoanalysis that one is dealing with the Oedipus complex, and the resistances would be so high that a normal patient, an ordinary patient, or let me not say ordinary or normal, let me say a common patient, would not be able to discover what is inside getting past the defenses. And even if he gets to, it would be very difficult for him to express. So even if you get over repression, it's very difficult to get over suppression. And therefore, Davanlu came up with this idea that we should give him, the person, a hint by asking him what are his masturbatory fantasies. Now, this is where Freud's idea of central masturbatory fantasy comes in. And from there, we are no longer theoretical, we are moving on the Freudian lines for dealing with deep-seated sexual complexes related to the Oedipus. And we see the Oedipus coming up only after giving the clues. So the Oedipus also gets validated, and the fact that everyone cannot be a Freud, even under ISTDP therapy, even ISTDP cannot make a Freud out of a normal person, that gets proved. And unless we help the person and bring in the theory, bring in interventions which are of classical psychoanalytic flavor, although done in an ISTDP format, you can't proceed with a group of patients. So Freud comes into ISTDP. Then it was realized the person may get angry hundreds of times and yet nothing would move, because it is the anger of the split. If the split is open, it is quite possible that the anger is being manufactured at that point rather than accumulated anger being catharted out. So closing the split becomes important. In fragile cases, if the split is open, it can also lead to projections and make continuation of ISTDP therapy very difficult. So client has come into ISTDP in terms of the split, that you have to bring in specific interventions to address the split. You can no longer say if split comes up, we will see what comes up along with it. So client has already come in. In fragile patients and depressed patients where there is a real deficit, clinicians have started giving support to the person. Now it's very ironical, a therapy which is based upon confrontation or challenge now talks about support, because it is realized that fragile patients and those with strong depression, they don't respond positively to challenge or confrontation. And there are self deficits and there are situations that need support, and therefore COVID comes in. It's also very important, something that I have seen, that those who suffer from early life mirroring failure, and I'm talking about cohesion mirroring, not the Lacanian mirroring, those who suffer from very early life cohesion failure, and the cohesion failure can be of many types, but let me focus on one particular part of the cohesion failure, the mirroring failure. And I have said it in some other video, some other discussion, that there are 5 A's of the cohesion mirroring: acknowledgement, attention, acceptance, affection, admiration. If there is a failure on these 5 A's, it is holding that works, and challenge and confrontation doesn't work. And that is something I think will soon come into ISTDP in a radical way. And so Kohut has already come. He will be even more at the center of ISTDP. So we see here a movement from a theoretical stance to a semi-theoretical stance, moving towards, over a period of time, in my opinion, towards a theoretical stance. Synthesis of the two is a richer, safer, and more efficacious position than on either of the extremes. Thank you.